Reproductive embryology, the umbilical cord. All right, so the umbilical cord, the one thing that you have to know, it's the most important thing, is that the umbilical vein supplies oxygenated blood from the placenta to the fetus, and it drains into the IVC of the umbilical of the fetus. Okay, now there's one umbilical vein, but there's two umbilical arteries. The two umbilical arteries carry deoxygenated blood, and they take it back to the mother. You have to know that. The way that we remember this is that arteries have two A's in it, so that means there's two arteries, and vein does not have any A's in it, so there's only one vein. All right. People remember it by the baby named Ava. So AVA tells you that there's two A's, two arteries, and one V for one vein. All right. Now, moving on, we have the Urachus. The Urachus is essentially a remnant of the allantois. All right. So if you see Urachus, it's just the allantois. And what the allantois was is the connection between the umbilicus and your bladder. So this is how the urine gets out from the kidneys into the amniotic fluid. All right. When you were in utero. But when you're born, this allantois should be obliterated, all right? And it should disappear because you don't want to urinate out of your belly button. It wouldn't make much sense, all right? If there is a remnant of the allantois, it's known as a Urachus, okay? Patent Urachus. That's all that it means, all right? If you have total failure of the Urachus to obliterate, this is known as patent Urachus. If you have partial failure, then you have urachal cyst. And if you have essentially a slight failure, then you have vesico-urachal diverticulum. Now, none of those really matter. The only thing that matters to me is when they're talking about adenocarcinoma of the dome of the bladder. All right. So a patient can present, it's an adult, and they might have painless hematuria. And then on further investigation, they find that there's a tumor at the dome of the bladder. If there's a tumor at the dome of the bladder, all right, and they find out that it's adenocarcinoma at the dome of the bladder, and the patient's going to present with in adulthood with painless hematuria, then that means they will ask you, where did this cancer come from? It came from the Urachus. So it has an increased risk for adenocarcinoma of the dome of the bladder. Very high yield. All right. But all the Urachus is just the remnant of the allantois. Failed obliteration. All right. The vitelline duct is just the connection between the intestines and the umbilicus. So this is when our waste products will be, thrown out. But when we're born, we don't want our waste. We don't want to poop out of our belly button, our umbilicus, right? So we hope that obliterates. If that does not obliterate, then we can get a patent vitelline duct. And this is going to be talked about more so in our GI section. All right. So be aware, later on we'll talk about it. But that's all for our umbilical cord, Urachus, and vitelline duct.